today, the plan is I'll do some updates from the Behavioral Health Division. Then Richland County is going to talk about what they're doing in schools for opioid prevention. Then I have some information on harm reduction vending machines, medication disposal boxes, syringe disposal boxes, and then I'll give an update on some federal regulation proposed changes that are related to opioid treatment programs. And then I have a few resources that I'd like to share with you guys, and then we can open it up if anyone wants to share what they're doing and talk about some successes, or if anybody has questions. Updates from us. So we are still finishing up kind of one-on-one meetings with all grantees and taking that opportunity to really get to know you guys and what you're doing, and then be able to support you any way we can. So I know most of you have had those meetings already, and I just want to say that if those were helpful and you need more of those in the future, please reach out to me and we can definitely set up some one-on-one times with everybody. Contracts should be finalized soon, if not already for some of you. I've seen most of them come through as far as sending out to you guys to get signatures. So if you haven't received anything from us, let me know and I can check into it a little bit more. But they're starting to go out and looking to be finalized, if not already. Reimbursements and monthly reporting forms can now be submitted for October, November, December, once those contracts have been finalized for you guys. And then we'll start processing them and getting some payments out to you guys. Lastly, the naloxone assessments were due December 16th. So we've got those and we're starting to review those. And then my plan is to reach out and kind of provide some feedback, whether it's in a meeting or just an email, to just let you know kind of what thoughts are and discuss it more if we need to. So now I will have Kayla Cook from Richland County hop on and let us know what you guys are doing for opioid prevention in schools. Do you have a PowerPoint, Kayla? I can. Do you want me to?
No, I was just
Okay,
gonna
perfect.
talk and I do, yeah, I have some things to share. And then I figured if anybody wanted anything else afterwards, I can send some resources and whatnot out. So what we've been doing right now is mostly I've just been in elementary classrooms and I've been going into first and second grade classrooms. I start next week going into middle schools and then eventually working my way up into high schools. But right now, obviously with 6 and 7 year olds, I'm not talking strictly about opioids, but we're talking about safe medication use. And there actually is a curriculum on Generation RX that I had found, and then we do give some handouts for parents lead. But I kind of go in and we just talk about, like, I ask questions, like what is medicine. We talk about different types, like over the counter, prescription, things like that. And then we talk about like who who should give you the medicine, and basically about like they should never ever take medicine themselves, where they need to ask a trusted adult. um, and then I start off by reading a story, and I'll hold this up here, and I found this on Amazon, and it didn't come strictly from Amazon, however, but I can get the link out. But it's just called Taking Medicine. And i I was a teacher previously for 13 years, and so this is very friendly with first and second grade classrooms. But it basically has, everything as far as like when you should use medicine safely, just things like that. And so after we are done reading the story, I play a game called Good Choice, Bad Choice with them. And I have, being a teacher, I have little props. So like if it's a good choice, they hold up their stick with good choice. If it's a bad choice, they do this. And we kind of practice with, like, do we walk in the hallway? Do we run in the hallway, walk in the hallway, things like that. Um, but I'll show you. And again, I can send information out if anybody would want, but I have these cards that I read. And like for one example, Cindy takes more medicine than instructed. And so then they would hold up their stick, good choice, bad choice. Um, and so there's just a few cards, but it's nice because it's a review, but yet the kids are holding up props. And then after that game, we review and we talk about, and I know I'm going through this fast, but I can send information. We talk about labels, and like if there's a prescription with labels, we talk about that, whose name is on the label, how much they should take. We talk about where to store medicine safely, things like that. And then the last game we play is called Medicine and candy. And so what I did is I filled Ziploc bags up, like for example, these are Tic Tacs. And so I would hold this baggie up and then they would hold up. I have cards made and they hold up, is it candy or medicine? And they have to guess. And the kids love these activities and they love props. If you've ever been in a first or second grade classroom, you know that they cannot sit still for more than 5 minutes. And so I just incorporated props for them to use and hand out. And then we also talk about, taking medicine can be helpful in some ways, but also taking care of your body, getting exercise, eating well, things like that. So we incorporate that in there too. And so we do some brain breaks, but um, that's kind of just the gist of the curriculum. And I go into the classrooms and it takes about 30 minutes. And then after it's done, we have water bottles and bracelets that we hand out with the Parent Leads website on it as well. And then just handouts and to send home like to parents. This is on the Generation RX. It's just the handout and you can find it on their website and I can share that as well. But just to share with families what I talked about with their kiddos if they come home talking about something and they have questions. So
Awesome.
any questions about that? And then I will know more. I mean, I'm doing a little bit, obviously it will be more focused on opioids with high school students and then middle school, they'll kind of get like a general background knowledge of that, but I have yet to go into the middle school and high school classrooms yet. I started with elementary.
So Kayla, how much of that comes from the Generation RX kind of curriculum stuff, and how much of that um, did you kind of incorporate from your past knowledge of being an educator?
So most of it actually comes right from Generation X, like all the materials. I had to make everything, but like the handouts and everything are right on the website. You can print them out. And then obviously I just made copies and then I laminated and cut cards out. And just from my background knowledge, I just knew which tools would maybe work better
Yeah.
in settings. And then obviously the candy medicine, I created and made that. They have cards, but visuals, it's one thing for kids to see it on a PowerPoint or on a piece of paper, but kiddos like visuals. So anything you can have that's interactive with the kids is much better. Obviously, when I hold the bags up, they don't get to hold it, but they love, I mean, that is probably their favorite part. They get so excited to see if they're correct, but the teachers have had really positive, good feedback. They're like, this is great information. They were so appreciative to come in. Miranda got to come in and watch me one of the days too. So maybe she can give you, I mean, some feedback too on what she saw. And then as far as the book, that wasn't in the curriculum, this book that I ordered, but I searched high and low for a book that would incorporate it because storytelling is a great way for kiddos to kind of learn knowledge because then it was fun to play the games to review instead of me just sitting up there talking to them. It was great to read a story and for them to see pictures with it too. So that's something I incorporated with it too.
Awesome. How many times did you go in? Was this like a one-time thing in a classroom, or did you go in several times?
Nope. So it was a one-time thing. It was a 1 30-minute class, basically. I mean, give or take, a few more minutes sometimes once you hand out, but you can do it in about 30 minutes or a little more. And I just went in one time and I've gotten into every school now in Richland County, first and second grade. I have two left. I have two coming up next week and one more this week. So, but lots of positive feedback. So hopefully we can continue doing this.
I'm excited to hear how it goes in middle school and high school. We'll have to maybe do another little quick brief and let you share how it goes with
Yeah,
the older kids and see how that is.
absolutely. Yes. Wish me luck.
Yes, yeah. Are there any questions that anybody has related to what Richland County is doing, or just opioid prevention in schools in general?
Yeah, Kayla, how did you like present this to the principal or the school board? Kind of like what did you frame it around? How did you kind of get buy-in from them to go in there?
So well, the nice thing is that I was previously a teacher for 13 years, so that was helpful, when they hear teachers coming in. But I taught in Wapaton Public Schools for 11 of those years. And so when I called and talked to that principal, I tried calling first to speak to them And then if someone I couldn't get a hold of, I would email, but I just kind of explained like where I was coming from, what I wanted to present to the kids. And then it helps to when sometimes it's harder to go in when you have to go multiple times, but when you're only taking 30 minutes of their day one time for the school year, they're usually better about having you come into the school. But all the schools were really open about it. Um, so I just either called and talked strictly to the principal or sent an email to them first. And then they would usually pass on my information to the teachers. And then I would just set up times and dates with the teachers individually. One school I did set up with the, which was Wapton, the principal. I just got the okay from the principal and then the counselor kind of set that up too. So the school counselor is another way to kind of go around that as well. Any other questions?
Well, thanks for sharing.
Yeah.
And either reach out to me or to Kayla to if you have any other questions that you think of later. And again, any other ideas that you guys want to implement in schools, feel free to reach out to us and we can talk more about that and how that might look. Or if you need support from us, feel free to reach out. I know that opioid and prevention in schools is not something that's happening a lot and kind of fairly new from my understanding. So we'd love to hear ideas and thoughts and how that can be implemented. Next, I wanted to share a little bit about harm reduction vending machines. I was able to look at some information. Actually, it was a webinar that SAMHSA had put on, and then can't remember who it was, had reached out to states to see what states are doing related to harm reduction vending machines. So I thought I'd collaborate that information and then share it with you guys just for your knowledge. So harm reduction vending machines are a great way to expand harm reduction services and syringe service programs. So the benefits are it takes less staff time because you're not really having to have that direct staff contact. It's a way to reach people who are resistant to services and actually coming into a building or a location. It's a way to reduce stigma by having them as a prominent thing in the community. And then a way to have collaboration and partnership when working with people or places to put these vending machines. Some common locations of a vending machine are treatment programs, community centers, primary care provider clinics, outdoor locations, which isn't probably as feasible in North Dakota when we have several feet of snow, but potential option, and then at syringe service programs. Here I put some types of machines, so like the brands of machines, and this is just for reference. If you are more interested in this option, that way you could have the actual names of what are some of the common vending machines places have used. Products that are placed in these vending machines include naloxone, syringe kits, sharps containers, mainly the smaller red boxes, fentanyl test strips, some first aid kits, wound kits, safe sex kits, condoms, pregnancy kits, hygiene kits, and then resources or information. So brochures, pamphlets, contact information for treatment providers, things like that. How do individuals access these machines? There's a number of ways. All of them stem from working with the agency, whether that's a local public health unit, a syringe service program, whatever it may be. But people either get a swipe card that they can swipe to access the machine, or a PIN code and type in the PIN number. Some people get both, and that way, if they lose their card, they still have a PIN number. Some of them have QR codes on the actual machine, and that's how people can sign up to get a PIN number. Or some other states have it set up that they actually have to go to a local public health unit or syringe service program to get signed up initially for the program. So these products don't cost the individuals anything, but they still need to sign up so that the agencies and local public health units can track kind of usage and things like that. And then they're tracked with a ID number versus like their name. So their name's usually not a part of the sign up. Questions that anybody has on the vending machines before I move on? Yeah, Karen, I see your hand.
I'm just wondering, I thought there was at one time that we talked about fentanyl test strips were not allowed to be dispensed unless you had a syringe service program.
Yes,
And
so that was,
so
yeah.
does this then, is this covered and allowable through the harm reduction
So
vending machine?
the fentanyl test strips would have to be in a machine that would be operated by a syringe service program.
Okay,
Hopefully that answers. Yeah, okay. James gave me a thumbs up too, so he agrees.
okay.
I see. Do you have more questions? Does that help,
No,
Karen?
no, I'm
Okay.
trying to lower my hand.
Oh, no, that's fine. I see in the chat, Robin said that Fargo Cass has a vending machine on order. Cool, that's exciting. I'm really excited to hear how that goes for you, Robin. And she says that you guys can reach out to her if you have any questions. How do they prevent people from sharing their PIN information? How do you properly track people? Yeah, and from what I was reading in the research, it wasn't so much that they needed to know who was accessing it and how many times. Um, Having that PIN number was able to just see how, like, they could keep track of the resources that were going out to be able to know when they could refill it, and things like that. So from the information I saw, they weren't tracking on an individual basis per se to see who was accessing it how many times. But it was more of an overall to look at their supply and usage overall. Um, RFID cards. I've never heard of those, Robin. So is that like a swipe card? I know you said your mic isn't working, but um, yeah, I'd love maybe for you to share sometime, Robin, after you guys get it in and get it up and running. Yeah, a swipe card. Okay, cool. That's really exciting. Miranda, I see you have your hand up.
I have a question about that. Not saying that we could or would, but that like a syringe program, could they provide that to like another county like us? Say Fargo Cass had it and then they could supply it in our county? Would that,
I don't see why not. It's a little bit new to me too. But I don't see why not. I think it could be a great partnership opportunity for sure.
okay, thank you.
Hmm. Any other questions? All right. Next, I wanted to talk a little bit about medication disposal boxes. There are some federal regulations regarding medication disposal boxes. So I read through them and kind of condensed the information because federal regulation is a blast to read. But and I just wanted, maybe this is new information for some and maybe this is repeat information for others. I wasn't quite sure what everybody knew about this. So I just wanted to share that medication disposal boxes, there are, first of all, there are regulations around the use and who can put them places and where they can be put. So the key takeaways from the regulations is that collectors can be law enforcement, manufacturers, distributors, or reverse distributors. So in other words, pharmacies, pharmacists, narcotic treatment programs, hospitals and clinics if they have an on-site pharmacy, and then retail pharmacies. So collection of controlled substances, I should clarify, can happen in the following ways: take back events, which most of you, if not all of you, are kind of implementing, mail back programs, and then the collection receptacles or those medication disposal boxes. Those receptacles can be placed in law enforcement locations or locations that are registered with the DEA. So those are kind of the two places that they can be placed. And then they did touch a little bit on take back events. And I just wanted to, this is probably repeat information, but take back events must be conducted by law enforcement, but you can partner with them to conduct that event. Just checking the chat here. What is the mailback program? So that would be when you are partnering with that whoever is there's several ways it could go, but essentially somebody that is registered with the DEA, then you can help individuals mail those controlled substances to that registered location. So probably the most common situation would be like a pharmacy working with them, or potentially working with law enforcement, but it seems that those law enforcement more so kind of sets up those medication disposal boxes and runs that more than the mail-in program, was what I was kind of gathering from the research. Any other questions?
Yeah, this is Holly in
Yeah.
Minot. So, okay, the reason this has kind of come to my mind is because the Minot Police Department had approached us about, they got money to have these disposal boxes. And so they asked about having one at our location, local public health. So what I'm seeing here is we're not supposed to have one based on what you've just said, or could we like go on and register with the DEA as a site, or do you have to have, what are the requirements to be registered in DEA?
Yeah, I was
You
actually,
understand
I
my
had that,
question?
yeah, no, I had that same thought too when I was reading through this. I'm like, okay, well then how does somebody get registered? And I was having a hard time finding that information. So I hadn't got that far yet to find that information. If I do find more, the short time that I did do some looking, I had a lot of trouble finding that. So I will look more, Holly, and get back to you. The short answer is I don't know what it takes to be registered. But I would agree that I'm also gathering that it would need to be in the law enforcement location or some other place registered with the DEA. Yeah.
So like pharmacy, I mean, we do have beds in our facility, but not like that, you know what I mean?
Yeah, right.
So,
right.
okay, maybe need a little more research on if we're even able to be a drop-off site.
Yeah.
I did look this information up, Amy. I have this saved, so I'll get this sent to you.
Oh, cool.
But I do have it. I just have to find my bookmark. So give me just a few minutes.
Yeah, that sounds good.
But from what I
Thanks.
remember, it is a bit of a process, but I'll find it so you can get it sent out to everyone.
For how to get registered?
Yes, with the DEA,
Okay.
there's some requirements that kind of make it so you have to be a pharmacy or a hospital or a specific type of facility, but I will double check just to make sure.
Yeah, that'd be great, Kelly. And then I'll send it out to everybody for you to check out. And we can even connect a little bit more, Holly, if you want kind of more one-on-one to walk through your situation and options too.
Yeah, thank you.
Yeah. Any other questions anybody has? So kind of along those same lines, I wanted to touch on then syringe disposal boxes, just to provide clarity and consistency to all grantees that the purchasing of those boxes, so those red Sharps container boxes, is allowable. However, placing them for anyone in the public to distribute has to happen in an environment where those individuals have access to linkages to treatment or harm reduction services, recovery services, things like that. Just having that not just have like a drop off location, but somewhere or somehow that they can be linked with resources if they want and need. So you can purchase the smaller ones and give out to people. Just having that ability for them to interact with you or even have the resources available to them, whether that's brochures, paper handouts, things like that even. Any questions? This is kind of all I had for the syringe disposal boxes. Any questions or things anybody wants to walk through with that?
So, quick question on this. By virtue of running a syringe service program, we've kind of been by default placed as the catch-all for all lots of medical waste disposal. So whether we want people to be dropping them off in our disposal box or not, we have become the default. I've been looking at partnering with our like with our public works department, for them to take over some of that. Would there be any possibilities of being able to use the funds, any type of funds to help support our public works, opening up a syringe disposal opportunity that would be accessible to the community? Because otherwise, it's just putting more money that's gonna pull out of our grant.
Right. Where would these disposal locations be? Do you know, Michael? Have you talked through that yet?
So what I had proposed to them would be to be at at like the Public Works hazardous waste disposal site. Um, so that would be, like on the other side of town, there wouldn't really be any type of services around, but we do operate, I mean, we have our outdoor syringe disposal and an indoor syringe disposal site on the same, physical location as our SSP, so that would be fine, but
Are you seeing a lot of syringe disposal, like coming from individuals that aren't necessarily having an opioid use disorder or substance use disorder? Like I'm thinking, diabetic supplies or other syringes related to other health conditions. Are you seeing that, or maybe it's hard to know too?
yeah, I get calls all the time for it. So people
Sure.
with dogs who are diabetic, and disposing of those syringes. Medical practices have been disposing their syringes in there. Um, those are kind of the two big ones. We have also been getting tattoos and dry needling needles in there. Basically, it's the only opportunity that's available in the community that's publicly available for that waste, and so we end up by default, getting everybody's small quantities.
Yeah,
Insurance physicals, that's been another one where we've been getting the waste from those.
sure. That makes sense. I can see how that would happen. Yeah, I would say that SUR funding can support the efforts related to syringe disposal, as when they're linked to treatment or are supported in other ways along with that. Um, I don't know that I have much ideas beyond that at the moment. I can do some more looking though for you for sure.
Sure.
Yeah.
This is
Yeah.
Holly, and then again, and that's kind of got me thinking, because we too have like a needle disposal container, like a mailbox type thing in our facility. So, and we get a lot of the same things Michael was talking about. I mean, it's pretty well used in our community because I think we're the only place that I know that does it. But what if you put some kind of information on the outside of the box, like a QR code, like if seeking treatments, so it's I mean, is that considered a resource when it talks about a linkage to or access to resources? Do you think that would check off that box?
Yeah, I do. I think that just having some sort of ability that if they need more, even just starting that thought for them, would be considered a resource. So yeah, even just information on the box, I would say so. Yeah.
Okay. My thought was, maybe you could have information on because we have a syringe service program too. So information about the syringe service program, and B, just information about treatment as a whole. So if
Yeah.
I like
Yes.
that idea about having it at a secondary location too. So I like that idea. Thanks, Michael.
Yeah. Even and it could go the other way, even information on that syringe disposal at the syringe service program saying if you're disposing of needles unrelated, here's a great option. And kind of getting that word out there that there's other locations for that type of disposal too might limit the traffic for those that aren't needing the syringe service program services. Yeah.
Yeah, well, I mean, our outside, because ours is an outside disposal box, so people who are in the syringe service can't use that if they want to, you know what I mean? Like if they want to do the syringe service, they have to come in and do all the necessary steps. So
Yep.
our box is just used just for all other I mean, not saying that people who
Yep.
use it for drugs don't deposit in there, but syringe service is specific to coming in and getting new ones, you know how that works. Okay.
Yep. Yeah. All right. So I wanted to give an update on some federal regulation proposed changes from SAMHSA related to opioid treatment programs. So the goal of these changes that they're proposing is to improve access and engagement in opioid treatment services. And then before I kind of dive into the changes, from the information that SAMHSA had sent out to us, I pulled out a couple, I think, really cool statistics related to OTP services, or opioid treatment program services. So mortality studies have demonstrated the positive impact of expanding treatment with medications for opioid use disorder, ranging from 37% to 80% reduction in overdose mortality. So I read that. I thought that was really cool, the kind of success of opioid treatment programs. And then a recent CDC study published in JAMA found that overdose rates related to methadone have not increased as a result of expanded take-home doses. And you'll see on this next slide that one of the things that they're talking about is making the take-home days more flexible. So I'll jump right into the third bullet point here, that one of the proposed changes is making permanent the flexibilities to allow patients take homes up to 28 days, of course, with the provider's discretion, which is similar to what kind of happened during COVID. So this is exciting, and it was cool to see the statistic that the take-home doses don't actually increase overdoses. Some of the other changes, back up to the first bullet point, is the ability to initiate buprenorphine by telehealth, which include audio-only technology, so they don't necessarily have to have that video capability. However, with methadone, they will allow for induction of methadone by telehealth, but it would need to be visual and audio. And then the fourth bullet point here, removing some stigmatizing language and creating more person-centered language. And then lastly, allowing mid-level prescribers to perform functions without the exemption process. So I think that's some really cool and exciting updates and proposed changes to the OTP rules. There is a public comment still open for public comment. And I can gather, I didn't include that in here, but please reach out if you are really interested in the OTP programs and want to read more about the proposed changes and have any comments that you would like to submit to SAMHSA. Please reach out to me and I can get that information for you. Lastly, I just wanted to go over some resources that I wanted to make sure everybody kind of knew about or had access to. The first thing I wanted to talk about was the one program option for doing screenings in correctional settings. So I'm not going to read through this whole slide, but this slide goes over what that process would look like for doing some screenings similar to what the one program has implemented in pharmacies, to be able to coordinate and link with local jails to implement some screenings and medication safety for individuals who are incarcerated for when they are released. The other resource related to the one program is they do have a pharmacy crosswalk, and I believe it was sent out to everybody, but correct me if I'm wrong, and I will get that to everybody. But it goes through all of the counties and then which pharmacies in those counties are a part of the one program. The one program had provided a one-pager, and I am planning to send that out with this PowerPoint and the recording after this meeting. So by using that crosswalk, you can see which pharmacies are a part of the one program and which ones in your areas maybe aren't, and then using that one-pager to start that conversation with them. The next one I wanted to point out to everybody is the resource of the Opioid Response Network. I had recently met with them, and they really wanted to share that they are available and really want to help and provide resources, education, anything you guys need. So if there are things that you want to learn more about, or any other resources that you might need related to opioids and stimulant use disorder, you can visit I put the link in here, And then if you hit the submit a request button and kind of give a broad overview on what you're looking for, they'll reach back out to you and help you any way you can. So you can always reach out to us, of course, but this is a great resource for you guys. I also wanted to bring attention to parents leads. So Sarah, if you're still on, do you just want to kind of talk about how you can help them and how they can reach out to you if they have questions regarding anything with parents lead materials or information?
Yes, absolutely. So we are actually currently undergoing a revamp of Parents Lead. So we're excited to kind of hopefully have that rolling out within the next few months. We're working with a marketing agency to, rebrand some of the messaging. Overall, it'll still have the same message, but just kind of updating how that's going to appear to the eye and be a little bit more appealing with some new colors, some new wordings and things like that. And so we also will be updating all of our resources. So if you guys are in absolute dire need, you can reach out to us and we'll see what we have on hand. We can do some ordering still of some of the things if you need it, but otherwise we're asking that you try to hold off until everything has the new messaging and the new branding on there. Other than that, if there's anything you guys need from me, I see Amy did put my email in the slideshow. So you guys can reach out to me with any specific needs. I've worked with a couple different areas on some like messaging. We're also kind of currently going around with some different ideas on how to help you guys get the words out within your local regions as well, with some possibilities of maybe doing some mini grants and things like that. So we'll keep you guys all in the loop in the near future with all of that stuff. So, but anything else, you can definitely reach out to me via email or phone as well.
Yeah, and I mean, if it's easier to access my email, you can shoot me an email and I can always connect you with Sarah too. Yeah, so there's lots of options for different parents lead materials related to SOAR and opioids and increasing protective factors, and there's lots of options. Lastly, I wanted to point out that we do have a report a save button on our new updated website. So this can be shared and put the word out there that you can individuals can report an opioid save after they've administered naloxone or Narcan. And really anytime that they administer the Narcan, they can report on this website. That's all that I had to share with you guys. I would love to open it up for any questions. If anybody has been implementing some really cool things, I know we're still kind of early in the grant cycle and have been, kind of working on contracts and the naloxone assessment and things like that. But if you want to share any other things that you guys have been implementing with other grantees or have questions for other grantees, feel free. This is kind of the opportunity to do that.
Amy, this is Tammy Birdhorse.
Tammy.
Hi, so I do have a few questions because we did receive the contract, but we had discussed the monthly reimbursement.
Yeah.
So has that changed at all?
Yeah, I can connect with you kind of one-on-one, and we can talk about that. I believe, is it tomorrow that we have? Yeah.
Tomorrow, what is
Yeah.
it, 3:30
So
or something? Okay, so we start the reporting then, even though we don't have a contract in place?
Tammy,
Is
it's
that what you're
okay.
saying?
Oh,
We
sorry
can't
to
James,
interject.
you jump in, James. That's fine.
Sorry to interject. Tammy, let's discuss that in our meeting we have with you tomorrow.
Okay, that's fine.
Great.
Yeah.
Yeah, but you can feel free to hold off on signing that contract till we meet for sure.
Well, there's a process we go through here that our contracts have to go through our legal first. And then I would have to, as long as legal says it's okay, if they had any changes, they will request those changes. It'll have to go back to your contract people. And then I still have to go through our process, which is our standing committee. And then our full tribal council, so that doesn't, that takes some time, so that'll take me a little time, so just that you guys are aware of that. And then the conditions of what we're gonna discuss tomorrow will determine whether or not, we will be accepting or whatever too.
Yeah, sure, that makes sense.
So I can continually request the Narcan then, how I have in the past for, SOAR, because we just finally received a big shipment, so we'll be getting that out. And, the requests have like become a lot more, so I just wanted to make sure that, I can still continue that and then count that in the SOAR grant also.
Yes, yep, you can still continue that. Yep,
Okay. Okay, that's all I had till tomorrow. Thanks.
sounds good, Tammy.
Yeah.
This is Steph Welsh from Cavalier County. We had kind of an interesting Narcan training request. We had a bank actually call and request training because they were worried about fentanyl exposure on contaminated money, which really hadn't occurred to me as an outreach in a small town. But that was a nice opportunity to get into that group of employees and do an employer training.
That's great, Stephanie. Yeah. Yes. Something to think about for sure. Yeah, when working in your area.
This is Holly and Minette. How long, so, you know, everybody has all this good information in the chat. Like, how long do we have access to this information? Like, if I want to go back and look at, is it there forever, or does it time out after a certain time?
Yeah, so what I'll do is I will compile this information, Holly, and then I can send it out with the kind of follow up after this meeting. That way you don't have to worry about trying to find the chat again and how long is it going to be there. So I'll do that. I'll compile this information and these links and include it when I send it out. So thanks for pointing that out, because that is a good point of, yeah, this is good stuff. Now, how do we access it when we need it?
Okay, thank you.
Kind of touching on that too, I did put in a few just kind of summarized in the chat with a couple of links, a little bit more information about like the LPHUs becoming a take back location, and everything I'm finding kind of minimizes that according to the DEA. So it sounds like for the most part, it has to be a registered like manufacturer, distributor, treatment program, hospital, or pharmacy, or a long-term care facility. So I think if there's like a practitioner that's located at the local public health unit, you could potentially contact the DEA and see if there are any additional like requirements where that might qualify. I know the closest DEA contact is in Minneapolis, St. Paul. But that's kind of the best information I could find. So I don't know if that's helpful for anyone, but Amy wasn't kidding when she said it was difficult to narrow down where this information is at. So
Yes. I'm glad you found it, because I struggled a bit.
yeah, when you actually go in, the very last link, if you actually go into the application process of registering with the DEA, it looks like they just require like both state registration as well as like a copy of like what type of facility or business you are. Like if you're a practitioner or if you're a long-term care facility, they require a copy of that type of business registration. So I don't know how that all fits in with the application process. That might be something where you would have to like contact like a DEA registration specialist and like ask those questions. So I don't know if anybody wants to spearhead that, but
Yes,
it might
if
be a bit of a
anybody dives into it
process.
more, I'd love to hear how it goes and what you learn and what you would like to share. It looks like Oliver, I see you have your hand up.
Hello, all. I just wanted to thank you, Amy, for talking about the Incarcerated One program for individuals for the Med Safety Box and naloxone. I also wanted to mention that at NDSU, we are rolling out a naloxone box similar to the concept of an AED box, where we have the boxes and a tutorial on how to use naloxone. That's going to be going to the NDSU campus, and we've also partnered with a couple of local public health units and counties that have requested those boxes to be distributed among the community. So I wanted to just take the opportunity to reiterate an open invitation to reach out to either myself or Heidi Uckel if you're interested in distributing the boxes to your community. And also, if there are any questions about the one program, had a couple of local public health units representatives reach out to me to gather more information. I'm available. I'll put my email in the chat. Please reach out, and appreciate the support that everyone has offered to their communities across the state. So thank you.
Thanks Oliver for offering your support and help too. That's awesome. Michael, I see you have your hand up.
Yeah, so I put in the chat. I put in where I've fulfilled all of the Next Distro requests thus far for the state. So, so Grand Forks Public Health is the state affiliate for Next Distro. A link's at the bottom of what I put in the chat. Next Distro is a national organization that seeks to increase access to naloxone, particularly for people at high risk of overdose. And they also have an arm that does things like syringe service as well. But they reached out to me. It was a partnership that formed over a year, and we are now using the state naloxone to fulfill these requests throughout the state as an extra touch point for people to get naloxone. So I started in September, and I fulfilled 35 requests this year between September and December, and I put in where those requests came from. Individuals who are seeking naloxone through Next Distro, they can click on that or go to that website and then put in the request. The request comes to me, I fill out, or I put it together in a package, put a cute little note in there, telling them that I'm including an extra kit and in solidarity and all that fun stuff. And then I do mail it out to anywhere in the state. So just a heads up on where requests are coming in, and I'd be happy to answer any questions.
Yeah, thanks for sharing that. Anybody else have questions or even just want to share about successes or brainstorm any barriers you're seeing?
This is Chelsea Ridge at Upper Missouri District Health Unit, and we just started implementing our Narcan training into our responsible beverage server training in November for the holidays. And it was very well received, and it's a good way that we are now disseminating it into our bars and restaurants. So
what a great collaboration there. I think that's a great location to put the naloxone and get individuals trained on how to use it too. Awesome.
Amy, this is Jody from Rural County Public Health, and I just wanted to make note. When we we received our contract for this grant, but the address on it was wrong, and when I sent it back, I highlighted that, but it was never fixed. It was just completely signed and sent back to me again. So it's completed, but it does have the wrong address. I don't know if that makes a difference for anything.
Yeah, we'll get that. I'll get that changed. I'll work with Julie probably and get that changed. Hey. Well, I don't need to keep you guys longer. So if there are things that you think of afterwards, feel free to always call me, email me, and reach out as needed. And if you have not received a contract for signature yet, let me know, because they should have been rolling out. So I just want to make sure to check in on anything if there was anything that got missed. So Anything else, feel free to reach out. Otherwise, I hope you guys all have a good rest of your day and good rest of your week.